So moral distress happens when you put aside your own values and you carry out an action that you believe to be wrong, which threatens the authenticity of your own moral self. This actually can be cumulative. Yeah. So, and it's called, when it accumulates on you, it's called moral residue. And so repeated episodes of moral distress that aren't resolved, they accumulate as moral residue, which can cause veterinary professionals to experience burnout and leave their jobs or even their careers. Moral residue is long lasting, and it's powerfully integrated into your views of yourself and your thoughts. And it's this aspect of moral distress, the residue that remains buried in your energy field, that can be really damaging to you and to your career. And it can negatively impact your patient care. It can impact your staff morale, obviously. And this is worse when there's morally distressing episodes that happen over and over and over. Part of compassion fatigue in us stems from the fact that we have not educated ourselves as a profession on the different types of empathy that you can use and what is more effective as a healer in someone who is constantly exposed to other people's grief, trauma, or other strong emotions, right? Empathy is often confused for a lack of boundaries. I tend to call these guys early warning signs. They're signals that something is out of alignment and you need to do some investigating, some intervention, or some personal or emotional maintenance. Otherwise, these two things will contribute to occupational burnout. And while these are mostly considered individual issues, how they are handled by both the individual experiencing this and the organization, how the organization handles this, contributes to whether the individual recovers, burns out, or develops more physical manifestations related to unresolved mental or emotional issues associated with the job.